Most men over 50 believe that feeling tired is just part of getting older. They wake up without energy, lose interest in things they used to enjoy, and notice changes in their body, but they don't see these signs as something medical. What most men don't realize is this: testosterone doesn't drop suddenly. It declines slowly, quietly, over many years. And by the time sexual problems appear, the body has usually been showing other warning signs for a long time. If you're over 45 and you've been dismissing certain changes as just age, this video may change how you see your own health. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and on this channel I explain medical topics in a clear and practical way, so you can better understand what's happening inside your body. Testosterone is the main male hormone. It's produced mostly in the testicles, and it affects far more than sexual function. Testosterone plays a role in muscle mass, bone strength, mood, energy levels, fat distribution, and even how your brain works. After the age of 30, testosterone levels naturally begin to decline, usually about 1% per year. For many men, this happens gradually and causes no major problems. But after the age of 45 or 50, some men experience a more significant drop. When testosterone falls below the healthy range for your age, this condition is called late-onset hypogonadism. The problem is that the symptoms don't appear all at once. They develop slowly, so most men don't recognize them as medical signs. They assume it's aging, stress, or lifestyle. Now, let me walk you through 7 silent signs of low testosterone signs that often appear years before erectile dysfunction, and that most men ignore. The first sign is persistent low energy. This is not normal tiredness after a busy day. It's a deep, constant fatigue that doesn't improve with rest. You wake up already feeling heavy. Your body feels slower. You lack motivation for activities you once enjoyed. Low testosterone affects how your cells produce energy, so this fatigue comes from inside the body, not just from poor sleep. Many men blame work or stress, but when this feeling lasts for months, hormones may be involved. The second sign is loss of muscle mass and increased body fat. Testosterone helps maintain muscle. When levels drop, muscle tone decreases even in men who exercise regularly. At the same time, fat begins to accumulate, especially around the abdomen and chest. This happens because hormonal changes affect how the body stores fat and uses protein. Some men also notice mild breast enlargement, known as gynecomastia. This can be confusing or embarrassing, but it's a known effect of hormonal imbalance. If your routine hasn't changed, but your body composition has, testosterone may be part of the reason. The third sign is mood changes and irritability. Testosterone influences brain chemistry. When levels decline, men may feel more irritable, anxious, or emotionally flat. Small things start to bother you. You lose patience more easily. Some men describe it as feeling disconnected, like life has less color. Low testosterone and depression can overlap, and sometimes one worsens the other. That's why mood changes should never be dismissed as just stress or personality. The fourth sign is reduced mental clarity. This is often called brain fog. You may forget names, struggle to focus, or feel slower during conversations and decisions. Testosterone receptors exist in the brain, and the hormone plays a role in memory and cognitive performance. When levels decline, mental sharpness often declines as well. Many men assume this is normal aging, but hormonal health can be a major factor. The fifth sign is decreased libido. This is not the same as erectile dysfunction. Libido is desire, interest in sex itself. Men with low testosterone may still have erections, but feel less interested in intimacy. Sex begins to feel like effort rather than pleasure. This can affect relationships and self-esteem, and many men feel uncomfortable talking about it. But this is a medical symptom, not a personal failure. Loss of libido often appears years before erectile problems and is one of the clearest hormonal signs. The sixth sign is sleep disturbances. Low testosterone is linked to poor sleep quality. Some men wake up frequently during the night. Others fall asleep easily but never feel rested. Testosterone also affects conditions like sleep apnea, which is more common in men with hormonal imbalance. Poor sleep then worsens fatigue and hormonal health, creating a cycle that's difficult to break. If your sleep has changed without any clear reason, this may be connected. The seventh sign is joint pain and slower physical recovery. Testosterone supports bone density and joint health. When levels decline, men may notice stiffness, joint discomfort, or prolonged soreness after physical activity. Recovery takes longer. The body feels less resilient. In some cases, men develop early bone loss, a condition often associated with women, but that can affect men with low testosterone as well. This sign is often mistaken for normal aging or arthritis, so hormonal causes are rarely investigated. Now, it's very important to understand this. Not every man with these symptoms has low testosterone, and not every man with low testosterone will experience all of these signs. Some symptoms may be caused by other conditions such as thyroid disorders, diabetes, depression, sleep problems, or nutritional deficiencies. That's why you should never self-diagnose. If you recognize several of these signs in yourself, the correct step is to speak with a doctor. A simple blood test can measure testosterone levels and help clarify what's happening. Treatment exists, but it must be individualized and medically supervised. This video is for education, not for replacing professional care. So let me ask you something. Have you noticed any of these signs in yourself, but dismiss them as just getting older? You can leave a comment below. I read them, and your experience may help someone else recognize their own symptoms. If this video helped you see your health differently, consider subscribing. I post content like this every week, clear, honest, and focused on what men actually need to know. And in the next video, I'll explain what really happens during a testosterone evaluation, what doctors look for, what tests matter, and why many men are misdiagnosed. Because understanding your body is the first step toward taking care of it. Thank you for watching. I'll see you in the next one.